Good evening, everyone, and welcome to another episode of Progressively Yours Health and Wellness Podcast. Hope everyone's doing well out there this evening as we are into spring now. Yesterday was the first day of spring. I'm Dr. Imani Ma'at.
J. Bernard Kine Sr.
And together we are Sankofa Institute for Wellness. And we are delighted to, we have a great show, we always do. We have a holistic dentist who is with us this evening, and I'm looking so forward to really meeting her for the first time and speaking with her. And Bernard has known her for some time. But before we get to our wonderful guest, we are going to start with spiritual opening, just to get us balanced and calm and centered and ready for a great show.
As is our tradition and part of our ritual, we always welcome the ancestors. So I'd like to invite those of you who wish to participate, if you would take the breath in and out through your nose, slightly close your eyes, and I'm going to read from verse number 7 from the Living Wisdom of the Tao. Verse 7. It is through selfless action that I experience my own fulfillment. Heaven is eternal. The earth endures. Why do heaven and earth last forever? They do not live for themselves only. This is the secret of ability. For this reason, the sage puts himself last and so ends up ahead. He stays a witness to life, so he endures, serves the needs of others, and all your own needs will be fulfilled. Through selfless action, fulfillment is attained. It is for the ancestors. Ashe.
Ashe.
Namaste.
Namaste.
Amen.
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 I like that selfless action. And I don't very often brag about my son, but my son Omar, this past week, he was driving and he saw a high-speed police chase, and something went wrong, and one of the police officers ran into a fence or a gate, and the car on fire. Anyway, Omar jumped out of the car, went and pulled his out of the car, and he said the guy was a big guy, like 6'5", and people have been congratulating him for doing such a heroic act, and he said, that's what everyone would have done, it's like it was no big deal. So I said, okay, well, I guess I raised you right. So hats off to him for, in a moment of extremity, that he did the right thing. And I was really proud of him. Selfless action it helps us to evolve. And I know that we're all evolving. So that was a good thing.
Mm-hmm. Proud of him.
Yeah, me too. And we also want to, before we get to our guests, because I know once we get started with our guests and having time goes so fast. So we're going to do a little commercial spot. A lot of people, businesses and individuals are looking for funding for real estate, for projects, for just business expenses, and are having a hard time. A lot of people have credit issues and just financial difficulty. So it's hard to get funding. And this particular company, Sequoia, will work with you. And I just recently got involved learned about them, and pretty much making referrals to them, and we'll see how things work out. But all of the information so far has been positive. So we're going to show you just a little spot about Sequoia, and if information, you can contact me and I will connect you with the company. And so we will. Janet, could you please?
The US has over 2 million electric vehicles on the road today. And with faster, cheaper, and longer-range vehicles coming, $550 billion has been invested by US car manufacturers to make sure no more gas cars will be manufactured after 2035. The new norm happening is called range anxiety, the fear of running out of power. More drivers need access to charging stations. But with more EV vehicles on the road, it is getting harder to find an EV station with affordable and accessible public charging. Fortunately, Zurich Geoenergy has an EV solution. We are launching the world's first direct marketing EV company in the $42 billion USA direct sales industry.
Okay, so that's not exactly the commercial I want to show, but Sequoia is partnering with Zurich Geo that's selling the EV charging stations. And there's a lot of exciting things going on between both companies. So if you want to look at the charging stations and how you can get involved, I mean, we're kind of going to a gasless society very quickly. And, you're seeing a lot more electric vehicles on the road. So it's the EV charging stations and other things that are involved with that company, as well as Sequoia that's doing personal and business loans for people. So with that, and you can contact me. The number is 757-452-0856. It's close, Janet. 757-452-0856. If you want information about either of those businesses and opportunities. And with that, I'm going to turn it back over to Bernard.
Thank you.
You're welcome.
It is my honor and privilege to introduce to the audience tonight someone that I do know, open confession that she is my personal dentist, and she was so last week when I was in getting my routine checkup, it just popped in my head to invite her to come on the show. And she said, "Oh no, I don't know if I can." I said, "You would be great. It would be fun." And I want to just introduce her based on some of the bio information that we have, and some things in the bio I'm hoping that she will talk about it. And in fact, we will engage her in conversation because I think it's very, very important information. So permit me to read some of this for you as we introduce our guest tonight, Dr. Zina Aaron. Rose Dental provides biologic and holistic dental care, which takes into consideration the health of the entire body, treating oral cavity. Treatment modalities considered mainstream in conventional dentistry aren't necessarily considered as safe or necessary in holistic, remember that word, holistic dentistry. Each person's care is unique to them, and the goal is to minimize toxicity in every way possible. Practicing dentistry since 2007, Dr. Aaron started a practice at the end of 2016 and began practicing holistic dentistry 5 years ago. While witnessing loved ones battle various health challenges, she saw conventional medicines kept symptoms at bay, but eventually stopped being effective. While pills may help to in the short run, she understood it was better to give the body the most optimal environment in order for it to heal itself. I hear that, heal itself. Thus, Dr. Aaron's journey began with the concept that minimize toxicity in the dental procedure and help patients achieve their best health in body and mind. One of the most important components of a person's well-being, she writes, is gut health. And I really want to talk about that. When the gut health is in check, so is dental health and vice versa. So there's a paradigm shift, she writes, that's taking place in dentistry that is sounding the alarm on our evolutionary shrinking jaws, and thus the airway. Currently, individuals are in about a fourth generations of retruded and deficient upper and lower jaws due to processed sugary food consumption, environmental toxins like of breastfeeding, and more. The implication of this is decreased oxygen intake the day, and especially during sleep, which can also have an association with sleep distorted or disordered breathing. One of the true current epidemics is sleep apnea. And so we'd like to hear more of that. Rose Dentistry is a female-owned and female-led practice. The team consists of fantastic patient coordinators, dental assistants, who are great taking care of patients. And they get the opportunity to interact with their patients, and I can testify that they are extremely friendly, very caring, and interested in the patient. It starts from the moment you walk in, the moment you sit in the chair, to the moment that you leave. Originally from, here I go, Uzbekistan. Uzbekistan. A former republic of the Soviet Union, Zina immigrated to Atlanta in 1991. Her schooling was completed in Georgia, including Emory University, undergraduate studies, and dental school in Augusta. She traveled after graduation and met her husband in New York City. After I enjoy a busy life with 3 children under 10 years of age. The family enjoys taking walks, riding bikes, and playing musical instruments. So it is my honor and my privilege. Dr. Aaron. Welcome, Dr. to Progressive Health and Wellness Podcast.
Thank you for having me. Really, thank you. And it was a great introduction. You got it right. You got the
Thank you. I had great on my side. So Dr. Aaron, before we get into the art of dentistry, tell us a little bit about your life. You mentioned that you were born in you said it again?
Uzbekistan. Yes. Yeah.
Tell us about your formation prior to the U.S. and after the U.S. What's your story?
Yeah, sure. So I was born in Uzbekistan and lived there until I was about 10. And my family immigrated here as refugees due to some, religious limitations over there. So we moved straight to Atlanta, Georgia in 91 when nobody knew about it, because it came on the map after 96 during the Olympics. So, and I've lived pretty much here ever since, except for traveling. I did my residency after dental school in Miami for 1 year at the VA hospital down there. And then after completing that, I actually moved to New York to do some teaching at the NYU dental school there. So for about 2 years, I taught over there as a clinical faculty. And again, so over there is where I met my husband. We got married there and moved here shortly after. And this is home now.
What is some early memory growing up and before coming to the U.S.?
Yeah, early memories. Gosh, we lived in a home in the city, and it was very much multi-generational. So I lived with my grandparents and aunts and uncles and cousins. So we all grew up in basically one house. It was like 3 apartments connected by one big yard. So I grew up with, all a noisy, bustling, very lively type home. And again, raised by parents, grandparents, aunts and uncles. And, and cousins were always around. And my grandmother actually was a doctor in over there. And she was making house calls and people would come to our house to get treated. So it was like an open door policy, very community based. And, I grew up watching her help people and, grew up in just a very busy household. So I remember a lot about it. And so haven't been back yet, but we hope to, God willing, go next year. So it'll be quite the memory, ride down the memory lane, I'm sorry.
I said, was that a Christian for you? Perhaps some move toward medicine?
Yeah, you mean with my grandma? Having my grandma around and seeing that. Yeah, I wanted to be in medicine, whether dentistry or medicine. I was like, I need to, this is something I can see myself doing. And actually, she passed away about 10 years ago, but I pretty much still think about her. And, when I have difficulties, even at work, she was a very very confident, very resolved woman. She was always, she really helped a lot of people. So every time I have some difficulty, I'm like, what would my grandma do? How would she handle this? So she's still, part of my everyday life. So, it's inspiring to have, such relatives. So such family.
Okay.
No, I I'm sorry for the echo. And I know that our production team is working on it.
Great.
So we'll try to speak individually until we have this on return. So we apologize. Hopefully from the dialogue.
Sure.
But I'm excited about your allopathic to I guess integration. So you still do Novocaine. Don't feel the pain.
Yes.
But tell us a little about that, because I know that many years ago, 30 years ago, I was referred to a mercury practice, and I still have the same dentist that I've had for 30 years. We both on great, and I really trust him and appreciate the work done over the years. Tell us a little about your journey relating to.
Yeah. So I started, doing allopathic traditional dentistry as was mentioned, but learning about the body, and again, watching my loved ones have health struggles. I was like, man, you can be on medication for a long time and it can keep symptoms, at bay. But then, gosh, eventually the body stops responding, or something happens where the body's like, okay, this is not helping me anymore. So then the symptoms come back, and I'm like, okay, how can we help the body not be dependent on medication? And what can we do to try to help it heal itself? Because the body wants to heal itself, right? When you have a cut on your finger, barring any some really odd disease, the body, it's going to clot. The blood is going to clot. It's going to heal, and it wants to. The body wants to basically take its next breath. It wants to heal. It wants to live its best life, if you will. So, does it really need medication? Sometimes it does, at least for a little while, perhaps, but it is capable of healing itself if we give it the proper environment. So, and that is to minimize, in my opinion, and in all the research I've done, it is to sort of try to minimize toxicity that we give to it, right? So any procedure we do in dentistry, in holistic dentistry, it's similar to traditional dentistry, but we just try to minimize the toxicity. We try to use materials perhaps that are more biocompatible with a person's body. And we even have gotten to the point where we can test your own individual body and tell what it's compatible with and what is it not. Based, it gets tested. We draw blood and it gets tested against all the materials that are out there, dental materials. And we basically get a whole book and we can see what can we use and what we can't use on you. Okay. So, and anytime we try to, for instance, consider, like, you have a toothache, should you get a root canal? Should you not get a root canal? What kind of information goes into making those kinds of decisions? And holistic dentistry is about treating the individual, not just doing what's, you normally would do on a patient that's healthy, for instance. So, we don't always recommend root canals, for instance. In traditional dentistry, you save a tooth at any cost. In holistic dentistry, we have to decide, hey, is it worth saving this tooth at the expense of your health? So we're having individual conversations every day with patients based on their overall health as to what we should be doing next.
Janet, please.
I can hear you.
Give us a second.
Sure.
Need the second. Okay, we're still working on it.
Okay. So echo now. That's a good sign. All right. So I want to just share a testimony in relationship to what you said about to minimize the toxicity with my own experience, because I had the regular feelings, the silver, the name is in my head now, the mercury feelings. And I had those in when I was in the military. And when I went to Progressive, Dr. Bouquet told me I had to get those out because of the toxicity that was causing in my gut. And I want you to also talk about gut health. Dr. Dressler, who got me shifted to you, removed, and he took his time. Very impressed. The first thing he did was to put this vacuum suction to my mouth to suck, the
Mhm.
toxicity from drilling out the mercury. And I remember him saying to me, I think I had maybe 7, and we spread it out in terms of the removal and then replacing with the new fillings. And when we removed the last 2, my whole body just had this strong reaction. I turned a little red, and he told me that whatever areas in my health that was compromised, that would show up, and my skin was that area. And for probably a year, my body was detoxifying from the toxicity that the mercury in my system. Say more about just the power of the toxicity that's in the that mercury filling put into the body and destroys gut health.
Yeah. So if you really wanted
Hearing you.
You can hear me? Okay, good. If you really wanted a close-up look at a true real life kind of a enactment of that, look up on YouTube. It's a video called The Smoking Tooth. So basically what happens is they simulate this environment where a tooth with the mercury in it is getting basically rubbed with a pencil eraser, which simulates chewing or any kind of friction that's put on a tooth when you're chewing. Your teeth are grinding against each other, of course. So what happens is the mercury vapor is what comes off of that, right? And in this video, they're measuring the amount of mercury that's coming out with like a actual mercury meter. And this is happening every time you're either drinking hot coffee, hot water, cold water, eating food, anything. So basically this mercury is coming off of these fillings, and you're swallowing that, and you're inhaling it, and it's basically getting stored. Mercury gets stored in fat cells, hair cells, organ tissues, all kinds of stuff. So and over time it just gets accumulated, and every time you're chewing, again, all of this is additive. So the goal is to, again, when we try to minimize toxicity, is when we remove these fillings safely from the person's mouth. And we basically do that together with a what we call a organ prep. In the beginning, you've got to take several types of supplements to help your body sort of detox the mercury. And then after that, you take heavy metal binders to try to basically remove the mercury from your stored cells. Again, this is not, so the thing is, this is not something that every person does equally. Every body is going to detox differently. So this is where, I can't practice medicine per se. I can only do dentistry. So I work with a functional medicine or a naturopath doctor who try to basically, we tag team together to try to help patients detox the mercury from their body. I can remove it from their mouth, very easy. That's what I do. We cover you up. We do all that, like you said, the external suction. We do a rubber dam. We do a charcoal slurry before and after. So whatever mercury does get in, which is minimal, it gets bound up by the charcoal and the activated charcoal, basically. So basically, we're trying to minimize toxicity. Again, everything we do, we try to minimize toxicity. So once we remove the mercury fillings, we refill the teeth with a composite material, which is like a, it's glass-filled type of resin. And again, we try to make it to where we select the material that's best for your body. And so the mercury gets either replaced with a filling or a metal-free crown, or an onlay, which is kind of like a filling, but ceramic. So basically the goal is to get metals out of the mouth, out of the body, and put in biocompatible materials instead.
And one thing. I'm still hearing it. Okay, so I think if we mute you while we're speaking and we're muted when you're speaking, we get rid of the echo. Okay, I don't know what's going on with technology this evening, but I know that one of the things you said is that the body naturally heals itself. So I think that's a part of it. And one of the thoughts I had was when I had my mercury fillings taken out, they did it over. I have mentioned this. They did it over a couple of visits because it's too much to do it all at one time, right? You have to give the body a chance to absorb or get rid of, the and the exposure, if you will, to the mercury coming out. And another issue that I think a lot of people are concerned about, I know most dentists say they come for cleaning like every 6 months. And some people say, oh, I don't need to do that. I brush my teeth. But, there's a deeper cleaning that people come to, to the dental hygienist once every 6 months. Can you talk a little bit about the importance of that? I've had friends who've had some serious health challenges because of I guess crud is getting down into the gums, and infecting. And I mean, I actually lost one good friend who had, ended up developing cancer of the mouth. So people need to know how important it is to clean, consistent flossing and so forth. Okay, so we'll mute.
Okay. Yes, I think what you are referring to is what we call periodontal disease, right? So the deep pockets in the gums, which have to be taken care of, because again, the pockets, they do store bacteria that, that's again another part of holistic dentistry, is that no part of the body is separate, right? If something's in the mouth, it's not just going to stay in the mouth, it's going to go down the rest of the body. And there's epithelial basically breakdown is what we call it. So when there's periodontal disease, meaning the bone that's holding your teeth in place, right, is being disintegrated by the bacteria that are sitting in the pockets. That's kind of one way of putting it. But that bacteria travels through the body, and has actually been researched, the same bacteria that's found in blood clots and heart attacks and all of that, it's also found in the mouth with patients with periodontal disease. So what happens here does not stay isolated is the point. We have to try to do our best to reduce the bacterial load in the mouth so that we give the heart a break. We give there's dementia risks, there's diabetes risks, there's heart attack risks, because, just having periodontal disease. So, yes, the cleanings, regular cleanings are important, deep cleanings are important, and again, too, gut health is important. So keeping the gut health in check is going to help keep the periodontal health in check, and vice versa. So you can't outbrush a bad diet or a bad gut. You've got to keep, you got to take in the proper foods. You've got to take good care of the teeth and gums. You've got to hydrate well. You've got to probiotic supplements. Anything you can do to try, digestion is super important. What our body's absorbing is important. We could be eating, I have patients who eat very healthy foods, very clean. They still have issues. So what's happening? The body's not absorbing what it's supposed to, right? So what do? I team up with a doctor, with a functional medicine doctor. We try to see what's happening here. Why are they not properly absorbing the foods that they're eating? Why is there indigestion? Is there improper digestion? Is there acid reflux? I mean, the list is endless, but the goal is to work together with a medical doctor or functional medicine or a naturopath and myself, and we try to get patients, into an area, into a place where they can feel like they're feeling better, they're healing, their body's actually doing what it's supposed to.
Yeah. That is truly a holistic approach to care, which is what we are interested in and what we're about, which is have a variety of guests like yourself to talk about an array of health-related issues in a holistic way. I was wondering if you could say something about this issue with the upper and lower jaw and how it's impacting breathing and sleep apnea, and you talked about the association that we need in the body, oxygen. Can you say more about those areas of.
Yes. So this actually originated, this concept, well, the concept of holistic dentistry to begin with, originated with a dentist named Weston A. Price. I'm not sure if you guys have heard of him, but it was a late 1800s, early 1900s. So he was a dentist in Ohio, I believe. And he basically started to see more cavities in his practice, kids with cavities, adults with cavities, like what's happening, you know? So he ended up traveling the world and going into the third world countries and examining the people, the indigenous people, and seeing what, you know, how are they don't go to the dentist, they're not, you know, they're not brushing their teeth even, how are they having nice white teeth, wide jaws, a room for all 32 teeth, which is what we should be having. And you know, they're breathing well, they're happy, they're energetic, they don't have this cavity disease, right? Cavities and shrunken jaws. So Weston Price kind of started this, and now we're basically, and he examined these indigenous people, and he saw that they have nice wide arches, forward growth of the jaws, again, room enough for 32 teeth. How many people do you guys know who've had to get their wisdom teeth out, right? Probably going 1 or 2 generations back. Yeah. So we should have room for our wisdom teeth, but we don't. So what's happening? Our jaws are shrinking. Why are they shrinking? Part of what, you know, Weston Price was saying, and then there's another guy named Francis Pottinger, but what they're saying is, you know, we're having more toxicity in our environment. We're having our food is less nutritious. We're having more processed food was the big thing, that and sugar is what Weston Price discovered was part of the issue. Flour, you know, and basically we're not chewing the food's too soft as well. We're not forcing our jaws to chew hard foods. Babies early on are getting purees. That's not the way that those people used to raise their kids, the indigenous people. So basically it's just our jaws aren't getting the workout that they need, per se, the muscles, because the muscles is what directs bone growth. So if we're not chewing harder foods, we're eating more processed stuff out of a box. We're not doing the, you know, eating from the ground. They also, by the way, those indigenous people ate from snout to tail. They ate the entire animal, right? They ate the organs. Liver is actually considered one of the most nutrient-rich foods. Liver is super healthy. I know not a lot of people like it, but they even put them in capsules now. So liver is really a superfood. You know, and lately, the last couple of decades, they're saying, oh, butter is bad for you. Not really. We have to have full fats, full healthy fats, right? Avocado, grass-fed butter, you know, things like that. Our body needs fat. What it doesn't need is a lot of sugar. So they're basically saying is what the goal of this is the wide jaws is which we're lacking right now. We're basically not growing forward anymore. Our jaws are pushed back, and that impacts the airway, right? So we're lying down. Our jaws don't have enough room for our tongue. The tongue is a muscle, right? So we've got same size tongues, but smaller jaws. When we lie down, what happens with the tongue goes back into the throat. That's a very basic explanation. There's so much more to it. But part of that is, you know, also kids are having tongue ties, lip ties. When a tongue is tied down, it can't sit up against the palate. It should be sitting against the palate at all times. At rest, when you're breathing, should be breathing through our nose, not through our mouth. We're walking around, you know, nowadays, if you watch kids, they're breathing with their mouth open. That's not good. When we're sleeping, we're snoring, we're breathing with our mouth open. Not good, right? So lips should be sealed. We should be breathing through our noses at all times. So all these things right now we can see in early on in kids. So we're trying to catch this early on and basically widen the jaws through expansion, through you know, proper diet, educating the parents on what to give the kids, what not to give the kids, you know, hydration. I mean, there's so many things that go into this, but the healthier we can give, the better of a head start we can give a child, the more they grow up with better genes. and then they can pass that on to their children. So we can try to reverse this trend right now, but it is going to take a couple more generations to go back to the way we used to be. So, yeah.
When you spoke about the indigenous communities that you looked at, the first time that I went to Africa, I was in Nigeria, 1982, I think it was, showing my age, but that's okay. I was just struck by how healthy people's teeth were. I mean, they were so white and so strong, and you know the old bottle tops that had the little ridges in. I would see them flip those off with their teeth, and I'm like, our teeth would crumble if we did that, you know. It's like, but again, like the sugar, you know, they weren't eating sugar, they weren't. I mean, they were eating things from the land and animal, you know. So a lot of yams and you know, the chickens and everything else, but they weren't eating sugary things. And so, you know, those soda bottles that I saw were probably one of the few violations, and you know, they have been, you know, imported or whatever, but they weren't indigenous to the area. And if they continued to consume those sodas, the teeth deteriorated over generations. But I was just struck by how white and strong their teeth were because of not eating processed foods and sugars and things.
That you nailed it. That's exactly right. And if you guys, again, if you want to really take a look at the difference of the jaws of those people versus ours now, I mean, really look at that Weston A. Price, and there's another guy named Francis Pottinger. He bred cats and basically gave one line of cats processed foods and the other raw food. And he saw with each generation the damage that was happening on the side of the ones that were getting processed foods. So really fascinating stuff. So you guys should check it out, and because and Western Price has some really good pictures of those the jaws. I mean, I have it in my head all the time. Like when I'm treating somebody, I'm like, we should be nice U-shaped, wide arch U-shaped. Nowadays we're V-shaped arches like this, very narrow. The tongue is like almost too big, and I see it all the time, you know. So, you know, the goal now is to try to reverse the negative trend. So,
And what would you say would be a way to reverse that trend? I know starting from our children, but what about adults as well?
yeah, for children, as I mentioned, it's yes, proper nutrition, nursing. Definitely, you know, moms should be encouraged to nurse because the muscles that are used during breastfeeding do help jaw development. You know, for adults, it's a little harder because we're done growing, but there are ways to help with jaw expansion in adults, and it is a bit of a controversial topic now in dentistry because we were taught to think that after we're done growing, we can't do that anymore. But there are ways to do this via certain appliances in the mouth that an adult patient would wear. And again, it's very individually based, so I'd have to take a look at you first to see if you qualify. But there are ways now. There are some pioneers who are trying to, you know, basically widen jaws as adults. So there are several appliances that can work. But again, it all depends on your situation. So, but the goal is to start young from the kids because again, it's genetic information that gets encoded. And then when they pass it on to their children, we don't have to, you know, don't have to work as hard to reverse that trend.
Do you want to mention what we're going to go to next?
Yeah. We want to thank you, Dr. Aaron. Go away. We're coming back and we want you to have the final. We want to introduce to our audience tonight, at least I do, a theme in my practice as a psychotherapist. And I had some sessions over the past few weeks that gave me this idea today that I want to share tonight. But before I share it, Janet is going to play a video and of a documentary which I'm in. I do want to say, I've not said much about it. I'm going to say just a little bit about it tonight, and then I'm going to share some thoughts. Janet?
Eagles versus pigeons, which one would you rather be?
I always said I want to be an eagle
Why?
because they fly higher than pigeons.
And what does that allow them to do?
See more.
Who are you?
So much of who I am today is my experience growing up in my hometown of Kansas City.
My mother had me at 15.
All I wanted was somebody to love me.
What have I done that's so bad that you can't forgive?
Mama set me up to go to prison instead of her. When the judge sentenced me to 11 years, I said, I'll show you. I think about the system that failed her. I am not what has happened to me.
Your story, your experiences, your being seen, just no accident.
Well, I kind of always escape through art. If I just took the next step, the world would open up before me. Scared this inner light within you. I am not what has happened to me. I am what I choose to become.
I had the opportunity and privilege of working with George. That movie still is on HBO Max, Master of Light. It was a delightful, interesting experience. We worked together for a year or so before the movie became public. And one of the themes of the show, when his mom said, "I just wanted someone to love me," was very important, and one of the things that did happen in their relationships, there was a theme of reconciliation between mother and son for all that had taken place. The theme that I want to offer for audience tonight came to me in one of my group sessions. As a psychotherapist, I conduct 7 therapy groups, 3 all women, 2 all men, and 2 men. And it was in one of the women's group recently that one member expressed and shared a dream in the group. And the dream was very short. There was a baby in the dream and a faceless gentleman with which she was shopping for a sofa. And that was the dream. When this particular member came to the group many years ago, she was in a very dark place. And there were other members who were in the group currently was also present when she joined and shared with her the disposition of a face of intense anger, pain, and suffering. She shared the dream in group. The group rallied around her and offered positive feedback in terms of watching her movement. One of the benefits of a therapy group that group members hold each other accountable for their total self-care. These persons are committed. They come on a regular basis. They put themselves in a position where they can be completely vulnerable and completely secure. Take risk to heal and heal each other. They also serve as a mirror reflection for each other. So as one member is offering positive affirmation to another member, that same member maybe oftentimes or sometimes may not realize that they're also talking about themselves. We also have to be careful what we say about other people, because what I'm saying about someone else, I'm also saying about myself. Mm-hmm. So the theme that emerged when I was thinking about how I want to talk about themes from my practice, was allowing myself to receive affection. Allowing myself to receive affection. Now, that's not easy to do because we live in a society, culture, community, and world that is full of negative judgment. And we take on that negative judgment. That the brain has neurons that take snapshots. And this begins in childhood, early on, and it settles in our subconscious, old school unconscious, and we walk around and we don't think about it. So we cannot avoid it. It's a part of who we are. So in a therapy group, when group members come together like this group did, and they offered positive feedback, positive affirmation, validating her maturation and growth, I watched this person just up in terms of receiving the affection. It was so overwhelming that she wanted to talk it away. And so I said to her, don't talk, receive. Now, it's difficult for us to receive affection. It's difficult. It takes courage to receive affection. But affection is a powerful antidote for transforming our lives from pain and suffering that we have endured throughout our lifetime. And so the more affection that we can take on and the more our lives are transformed and other healings can take place in the world and in our lives. So the theme for this week, last week, in my sessions with not only the groups, but also in individual sessions, couple session, has been moving towards learning how to receive affection. And receiving affection, love, as the mother said, I just want to love me. We're all looking for someone who can see us and who can love us so we can internalize this affection and feel good about ourselves and then go back to that to the world. So thank you. This is the beginning. I want to bring other themes from my practice that I look forward to going to sessions every day. I wake up in the morning look to getting to the office just to be with people because they allow me into their very sacred world. They see me as a seer, someone providing a safe place and space where there is no judgment and where nothing is required. An invitation to simply be is expected. So, thank you.
Nice. That's nice. And he didn't share that with me before, so I'm hearing it along with everyone else. But we have talked about that. So I think that's a really good thing for people to take and to practice. So I think that's a good thing. Judy Ventress says, "Amen." Thank you, Judy. And we do have a question for Dr. Aaron from one of us. Before we get to the question, we have a comment. You never know who's listening or who's watching. We have a Belinda Hicks who says she's a dental hygienist. And she says, I will definitely do more research. Thank you so much for sharing. So that was a really nice comment. And there was a question from one of our Facebook viewers. And she says, I had one mercury filling removed with a root canal. That's happened to me. I know I've had root canals. But can these be removed without destroying the root of the tooth? We'll let you answer that, Dr.
Okay, so yes, what I'm understanding is the question is, can the mercury fillings be removed without having root canals, right? Yes. So yes, they can. Again, anytime we drill into a tooth, there's always a risk of a nerve damage. It's a procedure, it's a surgery, it's a microsurgery, if you will. So there's always that risk. right? It all depends on how deep was the filling to begin with, the mercury filling, how much decay was underneath there. Sometimes the decay is not really visible on x-rays. So once we get in and we remove the mercury, the decay is to the nerve. So, and we won't know that until we remove the filling, unfortunately. So yeah, like I said, it is a risk, but again, our goal is to minimize root canals. We try to not get into those situations, but is it always avoidable? Unfortunately not. So we try to do procedures to try to help the nerve regenerate, or at least not die. There's things we use like ozone, like calcium pulp capping. Anything we can do to try to keep the nerve alive is what we do. But again, sometimes there are situations where it's just too much for the tooth, and it has to be root canaled, unfortunately. So it's just the nature of the game.
Thank you for that feedback, Dr. Aaron. And at this time, we're probably going to just allow you to closing remarks before we have to sign off. Time goes so fast, especially, well, sorry again to our audience and to you for the technical difficulties up front. We've never had that happen, but it's technically, and we do our best, and our support team behind us was working furiously to get rid of that echo. So we've put a Band-Aid on it, but we still have to figure out again next time. So we're going to turn it over to you, and then we're going to say goodnight to our guests and to everybody.
Okay, awesome. Well, thank you so much for having me. And Dr. Bernard, it is always a pleasure to treat you at the office. It really is. I love our conversations. You're always so open. I'm always asking you what's happening, and you just told me that you got engaged. So congratulations to the two of you. Again, I enjoy a part of, again, holistic dentistry, and this kind of talks about, is a little bit about what you were saying, is that we're energetic beings. As humans, we're energetic beings, and we're all connected, right? We all share this space. We're all connected. If a positive energy comes from you and I can feel it, I'm better for it, right? And we're all better for it. So, you were talking about the affection and with that positivity, I mean, it's so important to basically what you were saying, to have that connection with somebody and to get to know. And when I treat people, I try not to just treat them as a number. I want to get to know who you are, what makes you who you are. So again, that also factors into the decisions I will make for your treatment. What do you do for a living? What causes you the most stress? What can we do to help reduce that stress? How can we do what we do to cause you the least amount of stress? Because nobody likes going to the dentist. Let's be honest about that, right? So if I can get to know you and find out who you are and what's important to you, I can be a better provider for you. So, again, we're all connected. We all have our histories. We have things that, make us who we are. And that's part of what I like to know about my patients. So again, thank you so much for having me today. It's my first time. I'm super nervous, but you guys made it really comfortable. So thank you. I'm very grateful. So
you did a great job, Dr. Aaron, and we so appreciate you, and thank you for all that you're doing for your community, and for your patients. And we hope to have you back at some point, because the time is just never enough to cover everything. And you didn't seem nervous at all. You did a great job. And we still get nervous. We still mess up, and and that's okay. We keep it flowing. One thing that I want to say to our guests before we sign off is that I usually send out a newsletter, and I'm changing the newsletter to a blog post site, and it's on WordPress. So if you go to, you can go to DrImaniMaat.com, DrImaniMaat.com, and that will take you directly to the blog, because it'll give you notices about our upcoming shows. But you can also email me so that I can put you on the email list so that you get the announcements. because if you've been getting them on the Tiny Letter site, I'm going to stop that site. So my email, if you want to be on our mailing list so that you can get information about upcoming shows and share them with your friends, sign up on Facebook and YouTube and LinkedIn. My email address is my first and last name, imanimaat@gmail.com. That's the easiest one to share. I've got several, but imanimaat@gmail.com. Just send an email. Let us know how you like the shows and that you'd like you receiving notices about upcoming shows. And if you have ideas about shows, or if you yourself would like to come on the show or have people that you'd like to recommend to us, we're always open, as long as it's, generally about health and wellness. And that includes financial health and wellness. We have a number of people, that was one of our discussions recently, last week, in fact. So with that, we're going to end because we're a little bit over time. Thank you all so much, and we'll see you next week.
Dr. Aaron, hang around.
Okay. Have a good evening, everyone. Thank you.